So this communication is that uh, Ronnie is a child and his mother is um, Mira. Mira is against about Ronnie's MMR vaccine. Okay, she has some concern
Mhm.
about MMR vaccine. Now you have to talk with Mira about MMR vaccine. Okay, Dr. Reja.
Oh, okay, but I okay. I'm not prepared. Okay, ماشي. Yes,
Continue. I will then guide you next.
yeah. Good morning.
Good morning.
I'm Dr. Raja, part of child doctor team that working in this hospital. I believe I'm talking to Mrs. Mira, Ron's mother. Am I right?
Yeah, you are right.
Yes, Mrs. Mira. Nice to meet you, and nice for your coming.
Yeah,
Thank you
thank
for your
you.
coming. Yeah, yeah,
Welcome.
yes. Mrs. Mira, I'm here to talk about Ronnie's vaccine plan. Yes, shots plan. And before we starting, do you want anyone to attend this meeting?
No, my husband is busy outside. You can continue with me.
Yes. So far, how do you know about we are planning to give him the MMR vaccine? Yeah. So far, how do you know about this?
What
And
I
what is your
know, what
concern?
I don't know, it's not important. I want to don't give my child this MMR shot. I'm not interested.
Yeah, I appreciate you and you have right to not giving your child. But can I know why?
Because I know that MMR causes autism to child.
Yes, I'm really so sorry what you are feeling about. But let me tell you, yes, it was really, there was a poor result that came, only one result that said this condition. And we have many studies and research that's against this idea. So no role for MMR with autism. Are you with me?
Yeah, I'm with you. But instead, I am not interested to give him because what I have heard. One of my neighbor child who has taken the MMR shot, but later he has developed autism. So that's why I don't interested.
Really, really, I'm so sorry about your neighbor, but it's not proven. No, anyone who he gonna take autism, it's no role for MMR. Really, no role for MMR for autism. But that's let me tell you that he was diagnosed at the time of giving this job with Mrs. Zamira. That's why they tell that there is a relationship between this condition, autism, and MMR vaccine. Am I clear
Okay.
till now?
Yeah,
Yeah.
you're clear. But still, I'm not interested for this shot.
Um, why? You know, this is vaccine can protect him from condition called mumps. And this mumps, its drawbacks. He will have swelling at his cheeks here, and he may affect his private part. It's really serious condition. And what we call it measles, another disease is called measles, which is really a serious disease. I'm advising you, this is very good. It will protect him from this measles that can cause many drawbacks, including he has bad chest infection. Are you
Okay, I
with me?
understand that. But doctor, if my son he wear a mask, so what will be happen?
I want to, he, imagine with me, can he wear mask lifelong? first of all.
Okay,
Yeah.
but if he's surrounded people who already take the vaccine, they are vaccinated, does not he protect himself by that?
No, no, no. He has to take this vaccine to protect himself. It's not transmit to from people to another people. There's no role for this problem. Okay. Are you with me?
Yeah, I'm with you, but
Yeah, yeah.
maybe it is
Mhm.
working for other kids, not for my kid.
Yeah, really, it will protect him much. Yeah. And I want to tell you this: the diseases that he can protect him against, it is not unpreventable. You can't prevent them even with wearing a mask lifelong, Mrs. Mira.
Okay, I understand that, but still I'm not interested for this vaccine.
Yes, it's your right. I'm here to advise you. Why can I know why not interested after this many benefits I give it to you?
No, actually, I'm not interested, which goes, do you bring social service? Do you take my child for that reason?
No, no, it's your right to give your child a vaccine, and we have to let you write consent that you are accepting that we give him a vaccine. But I'm here to talk with you for the best interest of Turoni, Mrs. Mira.
Okay. Okay, doctor, thanks.
Okay.
But if I change my mind, then I can bring him.
I'm so happy that I feel that you're starting to changing your mind from now. And anytime you are so welcome to come and give Ronnie's vaccine. You are so kind, Mrs. Mira. Mrs. Mira, let's wrap up. If you have any other concern, please,
No, I
before
have no
wrapping,
any concern.
summarize. Okay.
Yeah, you can
Mrs.
summarize.
Mira, we talked about MMR vaccine, and we elaborate about the drawbacks of this vaccine. I'm here to reassure you there is no role with MMR with the autism. Yes, and I will arrange with you a meeting with a doctor specialized with infection to tell you more about this vaccine. And I will give you some trustable website and leaflet about to tell you more about this vaccine, Mrs. Mira. Okay?
Okay, thank you.
Okay. Thank you so for your patience and your time, please. Thank you.
Okay, so I think you completed it very nicely, and you have
Mhm.
mentioned all things. Now I'm just telling. First, about what do you know, how much you know about the MMR shot. Important or not, I do not want to give it to my child. May I know why? Because it causes autism. I appreciate ORIs, but let me tell you that it is only one study that conduct that result. It was a relation between the MMR and autism, and after that, many studies conduct not any relation at all. And also, the doctor who conducted this study was punished and prevented from practicing any medicine again. Okay, so my neighbor take the MMR shot, and the child has developed autism. I'm really sorry for him, but let me tell you that it is not related to MMR shot. But still, I don't want to give him. Why? Because I don't think it is important. I admire your knowledge. All of these viruses start with flu-like symptoms, but measles may later on affect the brain. I'm really sorry to tell you that, and also mumps affect his private brain and an organ in his tummy called pancreas. Rubella can affect his lungs as well. Okay, so they are telling the importance about measles, mumps, rubella, what organs affect. Then he will wear a mask. If I told you, I really admire effort for the best for your child, but this is not enough. You will not affect him 100%. He is surrounded by the people who take the vaccine so that he is protected by their protection. That you are saying is called herd immunity. This is actually a profession that vaccine is working, is not it. Maybe it is working for other kids, not for my kid. Ma'am, let me give you a brief how is vaccination work. Okay. Vaccination of the most of the time is effective in protection against the disease, but sometimes it is not effective 100%. But at this time, it will protect the child from severe form of the disease. So severe
Mhm.
form of the disease, it was 100% protection. Okay. how it works. I do not want to give the vaccine. This is your totally right. Do you contact with the social service? No. If I change, I will come. So this is all about this communication.